The question if the COVID-19 vaccine is safe or not is something that a lot of people are pondering right now. It's very hard to navigate the landscape of information because you hear one thing from pharma companies, you hear another thing from governments, and you hear yet another thing from people who are generally against vaccinations or are very fearful of the new vaccine. What I'm trying to do here is take you through the data, take you through what we know, and I'm talking about the solid scientific data here. And I will not make any decisions for you. You will make your own decisions. I'll just try to show you the data and explain things in a simple way. I have no particular agenda here. I'm a scientist by background, but I'm not working for a pharma company, and I'm also not against vaccinations in general. Just very briefly to the problem that we are facing now. So everybody knows about fake news, and the question is, how do we know if something's true or not? And how can we find out if the vaccine is safe for you to take or not? What can we rely on? So the answer to this question is we forget about everything that isn't hard data. We ignore expert opinions. We ignore individual points of view. We don't listen to newspaper articles. We ignore what the government says. We ignore what the pharma companies say, and we just look at the hard data. So let's start from the top. What does strong scientific data actually mean? Whenever a new drug comes out, the law requires pharma companies to make a lot of experiments to test that these drugs are both safe as well as effective. This data is then checked by the governments, and that leads to an approval process. So a drug that is approved or a vaccine that is approved has been tested and has undergone a large number of tests. These tests always have to be controlled as well. So that means one group receives the vaccine and the other group receives a placebo. They don't know that they received the placebo or the vaccine, and this will be only revealed to them after the experiment is over. For the most part, in any of the things that I'm going to talk about, I will ignore individual cases because a single patient doesn't necessarily say much about the safety of the vaccine. It just says something about that particular patient. As I said, we will ignore expert opinions. We'll also try to not go into this with opinions on our own. This is very important. You can only really figure out if something's true or not if you try to disprove your own current belief. You try to find arguments against your own opinion, and if you can convince yourself, then you are probably wrong initially. And if you can't convince yourself, even though you honestly try to find good arguments for the opposing side, then you are probably right to begin with. So that is an important point of finding out what's actually true and not just finding things that support your current point of view or your current state of emotions. Very often we have emotions and we try to find information that fits our emotions and that fits our current beliefs. But that's not really what leads us to a true view of the matter. One question that of course comes up quite easily and quite quickly is why was the new vaccine created so fast, and is it safe for that reason? So the reason why the new vaccines were created so quickly is because they use a new method. The new method is not entirely new. Some vaccines have already been created and are being used using that new method. But the main principle is in the old ways, so the way that we used to make antibodies, you take a piece, you take the virus, you create little pieces by cutting it into small fragments. Then one of those fragments you inject into the body, and your body thinks there's something here that is foreign, there's something here that I need to attack. It creates an immune response, and that immune response then works also against the full virus itself. So the little fragment is harmless, but the full virus contains that piece, and therefore your immune system also attacks the actual virus then. That's how it used to work. For that, you need to create that little fragment in large factories. That's a quite tedious process because that little fragment actually then goes into the vaccine. The new process uses genetic information. So here you start instead from the actual virus, you start from the genetic information, and you put a modified little piece of genetic information into the vaccine. And then when that is injected into your body, instead of the fragment, you get the genetic information for the fragment. The genetic information goes into your cells, and then they make the fragment where the immune system can react to it. The main difference here, if you want to use an analogy, on the left side, it is as if someone went fishing for you, they got you a fish, and then that's what you have. And on the right side, they just gave you the instructions on how to catch your own fish, and then you do that. So that's much faster. Just giving you the instructions is much faster than driving out with a boat and catching a fish. For that reason, the vaccine was much quicker. So you hear a lot of mention about the COVID vaccine, but actually there isn't such a thing as one vaccine. Right now, there are multiple vaccines which are made by different companies, and we'll have a brief look at the ones that are already approved or just about to be approved in the week that I'm actually making this video. And when I say approved, that means that the vaccine has gone through a number of clinical trials. So that means experiments with volunteers who either got the vaccine or got a control, and they showed an effect and they could demonstrate that the vaccine wasn't harmful to the subjects. So that's what we are starting with. All of these vaccines that are presented here are either already approved or will be probably approved this week. And you see the 3 vaccines here in green, and I've added one additional vaccine here, which isn't the COVID vaccine, but it's the influenza vaccine. So we have a nice comparison. This is the influenza shot that you can get every year if you choose to get it. So from left to right, we have the Pfizer BioNTech vaccine and the Moderna vaccine. Both use exactly the same technology, the one with the message that I told you about. And then we have the Astra Zeneca Oxford vaccine, which works slightly differently, but still remarkably similar to the other ones. But you will see that the differences actually show better stability of the vaccine in the end. So let's start from the first point here. How effective is the vaccine? Effectiveness means that if you get the flu shot or if you get the COVID-19 shot, how well are you protected from an infection? The Pfizer, BioNTech and the Moderna vaccine are remarkably good. So they have an effectiveness of about 90%, which is really, really good. The Astra Zeneca vaccine is a bit worse than that, but still really good with 75%. And the influenza vaccine has about an effectiveness of 50%. It's important to say that even a fraction of 100% is useful. So even having only a 50% protection is useful because it depends on how much of the virus you get. If you don't get a lot of the virus, you might still be protected. And if you have a lot of people take the influenza shot, then that means you can stop the infection going further. The second important part when it comes to vaccine is the stability in the fridge. And here we come to the first problem that is generated by using this new technology. The vaccines are much less stable. Less stable here doesn't mean that they become bad in the same way as milk becomes bad and becomes harmful, but it just means that the vaccine becomes ineffective. So you might still get the injection, but you don't actually have any benefit from it if it is not stable anymore. So the stability for the Pfizer BioNTech vaccine is a mere 5 days in the fridge. And that causes a lot of trouble to transport that vaccine to the places where your doctor can inject them to you. So that's a real problem with these new vaccines. They're not very stable. The Moderna vaccine is a little bit better, but not much, and it has a 30-day stability in a fridge. Compare that with the AstraZeneca vaccine, which has a 6-month stability in a fridge. So that's really useful. And the influenza vaccine has a 9-month stability in the fridge. So in that case, you can really have a doctor store this for a longer term. And if somebody comes in, they can get the shot without problems. The vaccination process, so once you decide to get the shot, what happens? In the Pfizer BioNTech case and also in the Moderna case and in the AstraZeneca case, you need to get 2 shots. You get a first shot and then either 3 weeks after that or 4 weeks after that for the other 2 vaccines, you have to get the second shot. The first shot doesn't fully protect you and only the second shot really boosts your immune system and makes that vaccine effective. So if you decide to go for the vaccine, you should definitely make sure that you get the second shot because you're not fully protected if you just take the first one. The influenza vaccine works a bit differently. There you only need 1 shot. So that's an advantage to if you want the old system of making a vaccine. Protection, once you got the shot, how long are you actually immune? So for the Pfizer, BioNTech, for the Moderna and for the Astra Zeneca vaccine, it's a bit similar. The data on this is not very strong yet, but it's about 3 months, which is somewhat short. And the influenza vaccine gives you about 6 months, which is enough to typically bridge the flu season without problems. So all of these vaccines give you a limited protection. They don't last forever, but it's still going to help curb the big spike in COVID cases. So let's have a look at the safety data now for these individual vaccines. So for any vaccine or any drug to be approved to be used by the population or on the population, it needs to undergo a number of trials, clinical tests that are well controlled, run in a hospital, and they have to be run with a large number of people. That makes sure that the effectiveness is balanced with the safety. In the course of these trials, doctors record adverse effects, so essentially side effects of the injection. This is then compared against the control group. So the control group just receives a placebo, and then you can say how much of the side effects that people had or report is actually due to the vaccine and not just due to getting an injection. Okay, so let's go through the different vaccines now and compare the parameters that are collected. So the first one is pain at the injection site. So same as with the flu vaccine, you can expect that there will be some tenderness on some mild pain at the site where you got the injection. There might be some redness and there might be some, tenderness and pain there. The next factor is muscle pain. So this is because the injection is also given into the muscle. You might experience some general muscle pain in the area. Muscle pain for the Pfizer BioNTech vaccine has been recorded to be about 8% have strong pain. For the Moderna vaccine, for the Astra Zeneca, and for the influenza vaccine, the percentage was very small, smaller than 1% of people who reported that. Headaches, about 15% got very strong headaches for the Pfizer vaccine. Less than 1% for all the others. It's worth saying that mild headaches are probably likely to occur, so you might feel light headaches after you got the vaccination. Chills, for the Pfizer BioNTech vaccine, about 10% reported severe chills, and about less than 1% to 1% are typical for the Moderna, AstraZeneca, and for a regular influenza vaccine. Fatigue, about 15% of people that got the Pfizer vaccine were very fatigued after the vaccination, about 10% for the Moderna vaccine, and about 1% for the AstraZeneca and for a regular influenza vaccine. No deaths occurred in comparison to the placebo group. This is an important comparison because people come into a vaccination with, for instance, a heart problem or something else. So it's important to say, was the death caused by the vaccine or not? So no people have died. It is important to say that there are a few cases with the Pfizer, BioNTech, and the Moderna vaccine so far. It might apply to the AstraZeneca, but we haven't heard that yet because it has not, to the point where I'm making this video, been approved. Where people with severe allergies. Severe means you carry an adrenaline pen with you. So people with severe allergies might also have a reaction to the Pfizer and to the Moderna vaccine under certain circumstances. So far, we know of 3 cases where that was the case, and that's 3 out of several thousand that have been vaccinated. So that's a small percentage. But still, if you have severe allergies to the point where you need to carry an adrenaline pen, please check with your doctor before receiving the vaccine. When it comes to the question of how long these side effects last, in no case did the side effects last longer than 7 days. For most people, the side effects are strongest after a second inoculation, after the second injection. So based on the data that we have now, you can probably expect something like a light to medium hangover type of feeling 2 days after the second injection. Now that we've looked at the side effects of getting the vaccine, let's have a look at the COVID-19 symptoms and compare those two. If you get infected with COVID-19, you have an 80% chance of getting a mild infection. So mild infection is similar to the mild symptoms you saw with the side effects. It means you will become potentially tired and get some chills and so forth. 15% have a severe infection. That means the infection is so bad that you need to go to a hospital and require oxygen to properly breathe, because your lungs essentially clog up and it becomes very, very hard to do even the simplest things. 5% of people who have a COVID-19 infection have a critical condition. So in this case, they have to go to an intensive care unit in the hospital and they have to be attached to a ventilator. And then unfortunately, about 1.4% of people who get a COVID-19 infection die as a result of that infection. These percentages are not equal across the population, but there's a risk group that tends to have the more severe cases, and other people, especially young and healthy individuals, usually have less severe cases. The risk group includes people who have already a lung disorder like COPD, people that are immune suppressed, have heart conditions, have cancer, kidney disease. Obesity is a risk factor at a BMI higher than 30. Smokers, pregnant women, and people with diabetes are especially at risk of getting a more severe form of COVID. On the right side, in this table, you see a comparison between COVID-19 and influenza, so the regular flu virus. And you can see the differences there and why COVID is treated differently than influenza is. The first one is that the death rate for COVID-19 is higher. Death rate for COVID-19, as I said, is 1.4%. For influenza, about 0.3% of people who have an infection. The incubation period, which is another important difference, is 5 to 7 days for COVID-19 and 1 to 4 days for influenza. Incubation period is the time between getting infected and showing symptoms. And this is really important because it has to do with how the virus spreads. So for COVID-19, we have the big problem that people get infected, but they don't feel ill for quite a number of days. So they go about their business, they meet other people, they infect other people, and only about a week later, they show symptoms. Whereas for influenza, it happens quite quickly after you infected yourself. That's also the reason why COVID became such a pandemic. Influenza and COVID spread the same way, so via droplets. The recovery period between the two, so the time it takes you to get healthy again, is about 2 weeks for both. And treatments for COVID-19, for now, we don't really have an approved treatment. There are some experimental ones, but we don't know yet how effective they are. For influenza, there are some antivirals available, but it's fair to say that also those are not incredibly effective. And now if we have a look at the symptoms that people with COVID-19 typically have, they are fever, chills, cough. Shortness of breath is particularly common, so having difficulty breathing or simple tasks becoming difficult. Also loss of taste or smell is very, very common. Headache, fatigue, muscle or body aches, sore throat, nausea, sometimes diarrhea. Those are the most typical symptoms that people experience. There is a very troublesome symptom as well, which is called long haul COVID. And this has to do with the ability of COVID to damage the brain, lung, and heart. Long haul COVID patients don't necessarily have to have a very severe COVID infection, but they show symptoms long after the 2-week recovery period. Besides these direct symptoms of the virus infection, it's also important to point out that the fact that we have a pandemic leads to a lot of socioeconomic problems. So many people don't have a job, don't earn a living right now. And also the lockdown itself has a strong psychological impact on people's lives. And another question is, are you immune if you had COVID? So you are likely not immune if you had a mild or asymptotic COVID. So if you didn't really have strong symptoms, your immune system very likely didn't do much work. And therefore you don't have antibodies or sufficient antibodies to counter a future COVID infection. People with serious COVID infections are most likely to be immune, and estimates at the moment say that that might last for up to 2 years. But we already know of many cases where people got reinfected with COVID after they already had it and got healthy again within a year. So it seems that the protection for many people is only temporary, and you can get COVID again, often a more severe form than you got in the first instance. Also, being exposed to more of the virus makes matters worse. So, for instance, attending an event where a lot of people are infected could make your infection significantly worse and significantly more severe than if you only caught a little bit of the virus. One question that also people ask a lot is, can we not just put the risk group on lockdown instead of the general population and let the virus run its course? Unfortunately, that's not possible. So we could not shield the risk group from infection if the infection rate would just be allowed to go unchecked. We see how this went in Sweden and also in the United States. The idea there was that we would maybe try to get herd immunity so that most people got the virus once, then they become immune and the virus runs its course and can't be infectious anymore. We know that it doesn't work. So Sweden actually had this strategy to begin with, and they had a large number of deaths and actually realized now that that was a mistake, and they've admitted to that mistake. Similarly, the United States at the beginning ran a strategy where internally they thought, let's just let the virus run and see what happens. And as we know, the United States right now is at the top of the number of deaths in the world. Besides the number of deaths, which of course occurs because a lot of people got infected, we can also see that now, so at the end of the year in December, the number of currently COVID-19 infected in Sweden is still about a factor of 4 higher than in its neighboring country, Norway. And these two countries are very similar in many, many other aspects. So we really see very clearly here that this strategy does not work. Also, running this strategy of only putting the risk group into lockdown means that the virus would essentially run free in the population. And that also means that the longer the virus is around, the easier and the quicker it will mutate into many, many different strains. We can actually see that happening right now. So what you see here on this animation is the virus that starts out in Wuhan and then spreads over the whole planet. And as the colors change, these are different strains of the virus, different mutations that start to grow and start to arise. And some of these mutations make the virus more aggressive. We already have seen some of these that led to a lockdown of the UK right now that make the virus much more effective. At the moment, the vaccines still work also for this mutated variant, but there might be future variants where the vaccine might not work. Okay, so this is all I wanted to get through. I hope this was useful to you. I'll just quickly summarize the main points. So we know that herd immunity unfortunately doesn't work for COVID-19, which is a pity because that would have been great. We know that COVID-19 is more dangerous than the flu. There are a lot of indicators that's the case, unfortunately. The new vaccines that have been made now are more effective than a regular flu vaccine, which is great. They also can have some side effects. So expect a feeling of hangover, a feeling of weakness or feeling tired after you get the shot. If you are highly allergic, before you get your shot, please talk to the doctor, just to be on the safe side. And that, in essence, is all I wanted to tell you. Please think about the pros, think about the cons, and then hopefully you make up your own mind.